Welcome. Today we'll be discussing coal workers' pneumoconiosis, or CWP, a serious lung disease affecting those who've spent years working in coal mines. Often called black lung disease, we'll explore what it is, how it develops, and what can be done about it. CWP is caused by the long-term inhalation of coal dust. Over years of working in coal mines, tiny particles of coal dust accumulate in the lungs. The amount of dust inhaled, the duration of exposure, and individual susceptibility all play a role in determining the severity of the disease. When coal dust enters the lungs, it triggers the body's defense mechanisms. Immune cells attempt to engulf and remove the dust particles. However, because the lungs are not designed to handle this type of excessive particulate matter, the dust accumulates in the small airways and air sacs, the alveoli. This accumulation leads to inflammation and scarring, known as fibrosis. Over time, this scarring can impair the lungs' ability to exchange oxygen and carbon dioxide, leading to breathing difficulties. CWP primarily affects coal miners. The prevalence of the disease varies depending on factors like the effectiveness of dust control measures in mines and the length of time miners have been working. Historically, CWP was much more widespread. However, despite improvements in mine safety regulations, cases continue to occur, highlighting the persistent risk for those working in the coal mining industry. In its early stages, CWP may cause no noticeable symptoms. As the disease progresses, individuals may experience a chronic cough, often with the production of black sputum phlegm mixed with coal dust. Shortness of breath, particularly during exertion, is another common symptom. In severe cases, COP can lead to significant respiratory impairment, affecting daily activities and quality of life. Diagnosing CWP involves a combination of factors. A detailed occupational history, including the length of time spent working in coal mines and the levels of dust exposure, is crucial. Chest X-rays and CT scans can reveal characteristic patterns of dust accumulation and scarring in the lungs. Pulmonary function tests assess lung capacity and airflow, helping to determine the severity of the disease. A lung biopsy may be performed in some cases to confirm the diagnosis and rule out other conditions. CWP can be broadly classified into simple and complicated forms. Simple CWP involves the presence of small round opacities or spots on the chest X-ray. Complicated CWP, also known as progressive massive fibrosis or PMF, is characterized by the development of larger masses of scar tissue in the lungs. PMF is a more severe form of the disease and can lead to significant respiratory impairment. There is no cure for CWP. Treatment focuses on managing symptoms and preventing further progression of the disease. This often includes smoking cessation, if applicable, as smoking exacerbates lung damage. Bronchodilators can help to open up the airways and ease breathing. Pulmonary rehabilitation programs can improve lung function and overall quality of life. In severe cases, supplemental oxygen may be required. In rare and advanced cases, lung transplantation might be an option. Prevention is the most effective strategy for combating CWP. Implementing rigorous dust control measures in coal mines is essential. This includes using water sprays to suppress dust, improving ventilation systems, and providing miners with effective respirators. Regular medical surveillance, including chest X-rays and pulmonary function tests, can help to detect early signs of the disease and allow for prompt intervention. Strict enforcement of safety regulations and ongoing education for miners are also critical. The prognosis for individuals with CWP varies depending on the severity of the disease. Simple CWP may progress slowly or not at all. However, complicated CWP or PMF can lead to significant disability and reduced life expectancy. Recent research is focusing on understanding the mechanisms underlying the development of PMF and identifying potential therapeutic targets. Advances in imaging techniques and biomarkers are also helping to improve early detection and monitoring of the disease. The goal is to develop more effective treatments to slow the progression of CWP and improve the lives of those affected by this debilitating condition.